Cheers, Claire. I'm just gonna share my screen, everyone. Hi, everyone. I'm just gonna pull some slides up, so hopefully you can all see that. Sorry, just close on me. Can you see the presentation? Okay, Claire. Yeah, nice one. All right, cool. Yeah, hi everyone. So my name's James. I'm from the Health and Wellbeing team, the BME Health and Wellbeing project lead, but also have a little bit of a lead on the financial wellbeing support stuff as well. So that includes Money Buddies. I've seen in the chat there's been a lot of questions around how to contact and stuff like that, and Leanne's put some contact details in there. But what I've done is in this presentation, I've put some QR codes so we can share this with you all. So it's got QR codes for like Money Buddies and some of the other stuff that we're going to talk about. So don't worry too much if you forget the links and stuff. We'll share the presentation with you. So first things first is just obviously thanks to Salim there for jumping on, joining us at 8:30 in the morning. It's really good. That QR code there actually takes you to the Money Buddies website. So if there was a question there around is it open to anyone, to family and friends and stuff, but that takes you to the Money Buddies website. There's that link there. So if you get a chance to have a look through the website and see what else is available from Money Buddies, that'd be really good. So there's a slide on here just on how to book Money Buddies again. So Leanne's put a lot of stuff in the chat there, but the appointments with Money Buddies can be made by scanning the QR code. Oh, look at that, Leanne's put the QR code in the chat as well. And then just to kind of reiterate, Money Buddies will be on site on the first Tuesday morning of every month at the RCN office at LGI. And then the Thursday afternoon of that week at the Unison office at Beckett Wing. So what we were finding, we were originally planned to have Money Buddies on site all the time, every session, but then due to a lot of people asking for virtual appointments, we decided to just have them in on a specific day of the month. And when you click through the link to make that booking, you can select whether you want a virtual or a face-to-face appointment, and it'll tell you whether it's at LGI or Beckett Wing. So if you want a face-to-face one, please book a face-to-face one. If you want a virtual one, which means you can do it from home or from wherever else, then please book a virtual one. So we tried to make it as flexible as we can, just to kind of meet the needs of staff as well. Hopefully after today, and with the help of the Health and Wellbeing champions, obviously we'll be inundated with appointments, and we potentially look at moving back to more face-to-face sessions if that's what's going to work better. But like I said there as well, if you need any further information, like Leanne said and Claire said, just drop us an email, the Health and Wellbeing team, and we'll be able to kind of pick up any queries and questions and let you know the best way forward. So I'm going to talk for the next 10-15 minutes around the Employee Support Fund. So the Employee Support Fund is something that we're really proud to have within the trust. So we've managed to get some support from the Leeds Hospitals charity, and we're able to offer a financial hardship payment to staff. So it's the idea of the ESF is that if there's been unexpected expenditure, so unexpected bill, if there's been household income's fallen, so say for example someone's been off work unwell, or partner's been off work unwell, or there's been an incident which has meant that they've had to kind of take a reduction in their income, we're able to look at supporting some of those stuff. And the big thing is that anyone working at any of our hospital sites can apply for support. That's including bank and locum staff. And what we just ask is that staff can clearly evidence how they're in financial difficulty, but I'll go into a bit more detail in a moment. So applications are kind of considered on the basis of the information provided on the form. So what we're trying to ask, and we had a meeting yesterday, and we're going to kind of update the form and just ask people to provide as much information as they can. What we tend to see is that people will say, oh, my wage has gone down £500 because I've been off sick, please can you pay £500? And obviously we need a little bit more information to kind of make some of those decisions. Or it might be that someone's clutch has gone in the car and they're saying, can I have £600 towards my clutch, and that's literally all they're putting. So we need more information just to make some decisions. So a lot of the time we have to kind of bounce back some of the applications just to get a bit more information for how that's actually financially impacted them financially. So that's really important to remember. So if you are signposting anyone, just ask them to put as much information as they're comfortable doing on the form, and then we can obviously make some of those decisions. So it says there, yeah, when considering whether a grant and award assessment will be made on the severity of the hardship and to what extent you've already taken steps to try and alleviate the hardship. So some of the other stuff that we're kind of looking at as well is whether they've contacted places like Money Buddies, whether they've been to Step Change, whether they've contacted Citizens Advice as well, or tried to access any other support around them that can, if they've made some of those decisions or had some of those conversations already, that's really important as well, and that kind of helps with the decision making process. And like I said, the panel reviews applications twice a week, and we've streamlined the process recently as well to make sure that where possible the money will be paid straight into your bank account that was held with payroll. So if there's any reasons why you wouldn't want it paid into your payroll bank account, then there is an option for you to tick when you're going through the application form to say you don't want that to happen, and then one of the admin team will contact staff to get an alternate bank account if that's applicable for them. So it makes it really easy. The payments are, I think the payments take between, I think it's about, is it about 5 to 7 days, Claire? 5 to 10 days, depending on when we process the payment and the application. So it's not a massive amount of time waiting. So we've really tried to streamline it. And like I said, we're in the process of updating the form again. I think in the last 3 or 4 months, we've made quite a few changes to the form just to make it easier for people that are applying, and also for the people on the panel just to kind of gather as much information as they can and make the judgments on what's kind of been said on the application. So it's really important. Just some stats from the last for the last since April. So this was as of last week, so it's actually changed as this now. But there was 91 applications since April for the ESF. 37 of those we had to decline. 44 were approved, and then 9 we were just waiting for further information. So the ones that were approved, 44. As you can see there, we've provided nearly £17,000 to staff. That's just since April this year, so that's a massive amount of money to obviously 44 different applications. It says 9 there waiting for further information, so those could be people that have provided or put an application and they've requested a certain thing to be paid, and we might have gone back to them and said, if you can provide a receipt or a copy of the invoice for the repair work, then we'll pay that. But those are, at the time we're pulling the stats down, we were just waiting on some further information from 9 applicants. And then the 37 declined, as you can imagine, and as Salim kind of said in his presentation there's been a massive, the cost of living has a massive impact on a lot of people, and we tend to find that for some of those 37 they're either long-term debt, which we're unable to kind of support with, unfortunately, or it's stuff around cost of living. So that's obviously causing hardship. And what we've tried to do is anyone that's been declined, we've offered further support and provided them with signposting to other services that may be able to help. So some of the services that we kind of signpost to are Money Buddies. This is one of the main ones. There's Step Change. There's Emmaus, which is local to St James's, which is they have like a superstore of like second-hand goods, so you can get microwaves, fridges, and all those kind of white goods from there as well at like decent prices. So we've tried to refer staff across to them in some cases. All kinds of different services. There's been services around supporting for childcare costs, which is, I want to say, Healthcare Workers Foundation. I didn't actually put a link for that in there, but I'll drop it in the chat. And they're able to look at providing support for childcare costs for those that work in healthcare. So as you can see, we're trying to build in and link with the food banks as well. So I didn't know that Money Buddies were going to be based in food banks through the Trussell Trust, but I'm just waiting to hear back from the Leeds Food Action Network to see about looking at how we can link in with them to provide support for staff that are in need of food or really struggling to afford food and the cost of food. So that's kind of where we're at with that. Just to kind of give you some examples of some of the really good pieces of work that we've done recently is we've had a member of staff that was actually homeless, was unable, that was sleeping, kind of spending time between sofa surfing and sleeping rough. We were able to support that member of staff into some accommodation on site and pay for their initial first month of accommodation on site. And that member of staff is now hopefully looking at moving into their own property, and we've been able to support with some of the costs for that as well. So that's really good. We've supported a member of staff in the last 6 months or so that's had She's been a victim of like ongoing criminal activity around the property. So she'd bought some, she paid for some CCTV cameras to be installed in a property, and we were able to kind of reimburse the cost of that for her upon receipt of the invoice. We've had nurses and like midwives that are out in the community that have had issues with their cars that they haven't been able to afford to pay for, and we've been able to put some money towards some of the costs to them as well. One of the things I haven't mentioned is that the most we can award in an application is £500. So as you can imagine, we get requests that are over that £500, that we're kind of capped at the £500 is what we can kind of provide. So all kinds of different applications we get. We're in the process again of streamlining some of the decision-making process, just so that it's a bit more black and white and easy for people on a panel to make some of those decisions. And like I said, obviously we've had 91 applications. That was, I think, Friday. That number was pulled on, and I think we had 15 on Tuesday as well. So that takes up to over 100 applications since April this year. So as you can see, we get quite a lot, and that's why it's important that we've got money buddies on side as well. One of the things that we are looking at is creating alongside money buddies, and hopefully meeting with them later on this week, just to look at if we can create some way of them kind of pinging people back to us, or if they come across a member of staff that hasn't been through ESF, they can make a referral for them as well, and then we'll kind of review it on the information that the money buddies have given as well to kind of speed up some of the processes as well. So that's kind of where we're at with the ESF. Does anybody have any questions about the ESF? Well, I'll do questions as we go along. No, nice one. So how you can apply, so if you scan that code there, that'll take you directly to the Google form or the Office document. I think it might be an Office one that we use for this one. It's really simple and easy to kind of fill in. And like I said, if you are supporting any members of staff around the ESF or talking to them, please just kind of reiterate to them that the more information that they can provide us, that means obviously it makes it easy for us to make a decision. Just to give you an example, sometimes we get people that have taken 20-30 minutes of filling in their application. They've provided they've provided budgeting plans, they've provided all the steps that they've taken, and then on the flip side of that, we might get someone that's taken like 1 minute and 35 seconds on the form, and they've literally just gone through and said, oh, I need money because my boiler's broken or whatever. So we need to have some more information. So as much information as they can get. They don't have to write War and Peace, and they can put it as bullet points or whatever, just so it's really concise, and providing as much information as they can. That's really, really important. The next bit is around staff discounts. So one of the most visited areas of the Staff Health and Wellbeing team website is actually around staff discounts. So please, if you're interested in that, as I know a lot of NHS staff are already aware of some of the amazing benefits that we kind of get. So on this slide here, I've just linked some of the staff discount providers that we've kind of got. Leanne's on fire today. She's dropped the link in the chat as well, so thanks, Leanne. But these are just some of the other stuff that's kind of, these are some of the providers that we use that you can sign up for with your NHS email address. There's Blue Light Card, which I mentioned on here. Leanne does a really good job at keeping our Facebook page updated as well with any new discounts that are kind of coming online. For those of you that have Blue Light Cards, you can get the Blue Light Card app. There's all the different ones on there as well. Staffbenefits.co.uk, My Trust Benefits, NHS Service Discounts, Red Guava. Obviously, a lot of stuff kind of happens nationally that you can kind of just get a discount for, like place like Office. You can access discount for I think 10% with if you go to Office and you show them your NHS discount, and NHS card. Nando's 20% off. Vans have recently just started giving staff 15% off, so I'm just in the process of ordering some new vans for my holiday. So please check out the website. There's a lot of different stuff. There's some more local discounts as well, so a lot of restaurants and smaller businesses in Leeds and the wider area offer NHS discount if you just ask as well. So that's really, really good. So please take advantage of some of those discounts. If you haven't already, then you will be now. That link there takes you to further financial wellbeing support. So if there's any other financial wellbeing questions that you might have, or anything else you're unsure of, that's outside of Money Buddies, the ESF and the staff discount stuff, there's some more bits and bats on our website, but like I said, unfortunately too much to go through just during this presentation this morning. So please scan that. Try to make it as easy as we can for you. And then just if a member of staff needs any further health and wellbeing support outside of the financial wellbeing, This QR code will take you direct to our intranet support, which obviously has the physical wellbeing stuff, the carers, the mental health and wellbeing stuff, as well as the financial wellbeing. So that kind of takes you, Leanne, look at that, Leanne's on fire. That'll take you to the intranet site as well. So please make use of these QR codes. We are trying to put QR codes and keep them updated as best we can, so that staff can just scan them and keep them on the phone. So this kind of, rather than having the text, it's just a bit easy for people just to do it that way. So thank you for listening. And any questions? Quite a short one, that one.